Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a primary care, weight management, and aesthetic medicine practice located in Great Neck, New York on Long Island.
Hi, I'm Sergio Fortich. I'm the patient account representative here at Northeast Medical Practice. And Dr. Berger, some of our patients have been telling us that they're feeling fatigue and when they're on the weight loss medicine, such as like Wegovy and Manjaro. What do you think? What are your thoughts on that? What do you think that fatigue is coming from?
Sure, it's a good question because, as you said, a number of our patients have been telling us about that in various settings, whether it's with our health coach or with me. I think that the largest part of this has to do with decreased caloric intake on the medicine. Some of our patients, the medicine works so well that their appetite is very suppressed, and they may be eating just one very small meal per day, and I think that's contributing to it. And it may also not be the necessarily the healthiest meal. It may not be the most nutritious meal sometimes. I think that's part of it. If you look at the studies for Zepbound, for example, maybe about 5 to 7% of people in the studies actually reported fatigue. And these were folks who eventually got up to the higher doses of the medication during the study and then stayed on it for a long period of time. And so it wasn't really jumping out in the data for the clinical trials for the medication. So while it's possible that might be causing part of the issue for people, I think for the majority of folks it's decreased caloric intake. There's just the general issues of sleep and things like that we often need to address in our patients that may be contributing to. I would say that these patients, and what we try to stress with them is that they need to really eat nutritious food when they do eat. Perhaps spread things out with small meals throughout the day rather than just one meal, because they really may kind of run out of fuel later in the day. I also tell my patients from another standpoint in terms of muscle mass loss to eat their protein first. So if they're going to get full really quickly, they should really front load the protein so that they're not losing muscle mass. Really, the more muscle mass and the more that folks are, engaging in exercise, maybe working with our exercise physiologist, Peter, the more energy they're going to have too. There's a bit of a vicious cycle there as well. But I would say the main things are make the meal nutritious, maybe spread it out a little bit during the day, eat protein first, make sure that there aren't any sleep issues going on, such as sleep apnea or any insomnia, things like that. And then we can always think about decreasing the dose of the medication. Not everybody needs to be on a high dose, even though it might induce the most weight loss. If we're having side effects, nausea is really the most common one that people have, GI side effects, then we're going to decrease the dose. That's also the reason that I like to have my patients come in at least once a month, so that we're checking in on them and making sure they're not having side effects on the medicine and so forth.
Good. Wow, great. Thank you so much for letting me know this. I think our patients really will, look forward to understanding where this fatigue is coming from.
Okay, thanks very much. And as always, all the comments that I make on these videos are for educational purposes only. We have not established a doctor-patient relationship yet. And you should always seek medical attention from your own medical providers if you have questions. If you'd like to learn more about our practice and also find other articles and videos about relevant topics, you can visit our website, which is northeastmedicalpractice.com, or call the office 516-604-3418, and we'll see you next time.